Let me begin by acknowledging and thanking Ann Lurie for her sponsorship of this award, not only for this year, but for years to come. Ann is not only one of Research America's principal benefactors, she is a philanthropist of the first order, supporting medical research and patient care. It is a delight to have her here and to renew our longtime friendship with her and Mark. Thank you, Ann. Now let me tell you a little story that bears on my relationship with Dr. Louis Sullivan and his lovely wife, Ginger. One day when I was in Congress, my son David calls and tells me he's living here in Alexandria and working for the Republican National Committee. I had no idea either one in mind, and if I had known, would probably have tried to talk him out of working for the party. Although I was elected 11 times as a Republican, I was never much of a party person and represented a district that was fiercely independent. Anyway, when President George H.W. Bush, a national hero, appointed Dr. Lou Sullivan as Secretary of Health and Human Services, the party committee asked my son to go with him, and I suspect to make sure he doesn't do anything good for the Democrats or bad for the Republicans. I was hoping David could be here tonight, but he works for the Illinois State Medical Society, and there was no room in his schedule for coming to Washington at this time. So I asked David, who became with Ronnie Lancaster, who is here. Ronnie, why don't you stand up? They became part of Lou's staff, and if he could say something about Lou Sullivan, I asked my son, what would it be? David said, Lou Sullivan is a perfect example of what a public servant should be. I would go a step further and say that Lou Sullivan is a perfect example of what a human being should be. Now, you can read about his background and accomplishments in the program, and please do. But I couldn't be more proud of Lou Sullivan, a man of huge integrity, monumental modesty, personal dignity, and quiet leadership, showing us how we should act not only on the public stage, but in our interactions with one another. That is, with respect and understanding, listening to the thoughts and needs of the other person, finding a way to work together to improve the course of events and therefore the future of our world. So it is with great pride I present the first Research America Legacy Award in my name to Lou Sullivan, a man I not only admire, but one I love. Lou Sullivan.
Thank you. Thank you. John, thank you very much for those generous remarks. And let me begin by saying I am deeply honored to receive this award from Research America. Because as you've heard, in 1989, in January of that year, Research America was founded. January of 1989, I began as U.S. Secretary of Health and Human Services. So we have a lot to celebrate together. For me, this was a transition from the academic world of teaching and research and administration to the world of health policy, health administration, and working to improve the lives of all Americans. That year, you remember, we were fighting this new virus that had been discovered in the early 80s, that when diagnosed, people knew they had a limited number of months or a few years to live. Demonstrators were in front of the Humphrey Building. They had smoke bombs on the campus of NIH because of the distrust of many in the community of NIH and this new administration. I was pleased when George H.W. Bush, in his first budget he submitted to the Congress, proposed $4.2 billion for AIDS, education, research, service, and care. Because of that beginning, today, this virus has been changed from causing a fatal disease to now a chronic condition with people living decades, raising their families, working, paying taxes, and indeed enjoying lives. Now, this evening you've heard about the Women's Health Research Program that's underway, and I'm pleased that Congresswoman Nita Lowey and Speaker Pelosi mentioned that, because we were also pleased to recommend to President Bush the appointment of the first and only woman to head the NIH as director, Dr. Bernadine Healy. Working with Dr. Healy, we developed the Women's Health Research Program that was funded and headed by Dr. Vivian Penn, who is here with us tonight. And as you've heard, that program has grown since that time to really change our ideas and our information, our understanding of how disease affects women as well as how it affects men. We also were pleased with Acting Director of NIH, Dr. Ruth Kirstein, to create the Office of Research in Minority Health in 1991. And over the years, that has grown from an office, then to a center, and now an institute. So the National Institute for Minority Health and Health Disparities indeed had its beginnings during the opportunity I had to serve as secretary, and I'm very pleased to have had that opportunity. I got to know John Porter when he came to the Congress, because I was then president of the Morehouse School of Medicine, and like many heads of medical institutions, I came to Washington to tell our story about what we were trying to do at Morehouse, and we found great interest and support from John Porter, along with others in the Congress. Little did I know in the early 80s that I would be coming to Washington in 1989, because when I became secretary, I worked with John Porter, became chairman of the Appropriations Subcommittee for HHS, and he really supported our efforts in a great way to the benefit of all Americans. And he was particularly interested in those who were not being well served by our health system. The Association of Minority Health Profession Schools, representing minority health institutions, met with Congressman Porter and others on a number of occasions, and because of their interest and support of the perspectives we brought, our institutions and the programs that affected us were made stronger. So, John, I want to say personally to you, thank you for your continued leadership that you gave during that time. Now, another reason I'm honored to receive this award is I had the opportunity and the pleasure of serving on the board of Research America and got to know so many of its leaders, Paul Rogers, John Porter, and many others. And I was inspired by them and by Mary Woolley with her leadership and her energy. So indeed, in receiving this award this evening, I am doubly honored, and I also want to congratulate tonight's other honorees. I want to thank those many colleagues with whom I've worked over the years. During my career, when I was a real doctor, doing research and taking care of patients and carrying out training of hematology researchers. Those who really worked with me as we developed this new medical school, the Morehouse School of Medicine. I owe a great debt of gratitude to all of those who have taught me along the way. But the person to whom I have the greatest gratitude is my wife, Ginger, who stuck with me over all the years, gave me encouragement and support, and really runs as the CEO of the Sullivan household. So Ginger, thank you for what you've done. We need to continue to work with the Congress, with the administration, with the American public, to be sure that people know how important research is, because I think there can be no stronger example of the value of research than what's happened in the last few decades from changing AIDS from a fatal disease to a chronic disease, and hopefully soon there will be a cure. I was also pleased with the report on 60 Minutes with Francis Collins about sickle cell disease with the possible gene therapy. Because I remember my days back in the 60s at Boston City Hospital where I ran the sickle cell clinic. We really had very few patients who were older than 20. Now that picture has changed because of better therapy, and with gene therapy now posing the possibility of a cure. And I heard, Francis, you say it on television that this looks like a cure. So we're going to hold you to that, because this is something that will be a great achievement. Research benefits everyone, rich, poor, black, white, Hispanic, Native American. It improves our economy because we need to have more of our citizens healthy, working, raising families, earning income, paying taxes. That makes for a healthier society. So the fundamental reason we will get to that will be because of the work of Research America. So to all of you who are the recipients tonight and those who are supporting research, I'd say thank you very much for what you do, because you're helping to make this a better world. Thank you.